Time once again for a look at what's making headlines in the field of heart health. Heart failure affects millions of Americans. That's when the heart cannot pump enough oxygen-rich blood to the body's organs. Part of the enormous cost associated with the problem is rehospitalization. That makes self-care an important part of the treatment process. Joining me is nurse practitioner Jane Thayer of Thoracic Transplant Service, Baptist Memorial Hospital, Memphis. And well, Jane Thayer, welcome to Heart of the Matter here on Smart Medicine. We hear the term heart failure. We talk about it. We hear it on the news. What is it?
Heart failure is basically the heart's inability to pump sufficient oxygen and blood to support the other organs of the body. And a common misconception is that, well, it is not that the heart has stopped beating. It's just not supporting the body sufficiently.
Okay. How important is self-care in heart failure?
Well, because heart failure is a disease of the elderly, and many of them are hospitalized for this, it's a matter of not just medical care through health providers and family support, but it's a matter of the patient taking charge of their own self-care through taking medications on time, weighing themselves daily, following a low-salt diet, getting their flu and pneumonia vaccines every year. So they have to be responsible for what's going on.
And taking those medications at the right time is critical, right?
Absolutely, the right dose at the right time. And what complicates things is that patients with heart failure oftentimes have to titrate or change the dose of their medication based on their daily weight. So if they don't weigh themselves daily, they risk becoming overloaded with fluid, thus contributing to worsening of their heart failure.
And how important are diet, exercise, and other lifestyle choices in this question?
Well, they're absolutely crucial. They're just as important as the medication therapy. Medication alone cannot keep these patients well balanced. It takes limiting the sodium to 2 grams a day, and limiting their fluids to less than 2 liters a day. Again, I said weighing themselves daily. They must get regular exercise to keep the body organs functioning.
What about symptom monitoring and the use of health services, Jane?
Okay, that's a good question. Symptoms of worsening heart failure would be increasing shortness of breath. Or say when you're out taking your daily walk, you can only walk a half a block where you get short of breath. Anything that worsens, worsening swelling in your legs or your abdomen, you need to be sensitive to these changes and let your healthcare provider know so that they can make the necessary changes in the medications or diet.
Very good. We need to be attentive to the symptoms.
Absolutely.
All right. Thank you very much, Jane Thayer.
Thank you.